Hello, friends. So I'm back with another video of daily clinical tip series. Today, first, I would like to clear a doubt about one query which I have received. First, that is about the difference between delusion wrong suffered and remorse. When to take and when not to take. Second, another query regarding hyperactivity disorder, how to approach. So, briefly, I would like to narrate. And the third thing is hyperhidrosis or dyshydrosis. So, the conflict of hyperhidrosis or dyshydrosis, I would like to narrate. First thing about the difference between delusion wrong suffered and remorse and when to use. So, what is remorse? Remorse is a strong feeling or you feel sorry for something which you have done. This is the dictionary meaning, or a feeling of regret which you feel after doing something, that is remorse. So, this is a feeling that happens after a certain event has happened. Okay, and this person is looking back on today's reference, is looking back into the past, and the person wants to correct what he has done in the past. So this is what is remorse. And delusion wrong suffered is what wrong suffered. So suffered means when you have experienced certain unpleasant event, when you have been punished for a long time, or you have sustained damage. Okay, so that is suffering, or you have been encountering trouble for quite a long time, so that is suffering. Wrong suffered means you are not supposed to uh, face so much trouble in life, still you are facing. How the patient will narrate to you this delusion? Actually, this is a feeling, subjective feeling, or a perception or a false perception of a patient towards his own life. If the patient is looking towards his life from this end to that end, so he has a feeling that he was troubled and he was unnecessarily troubled by so many different things. So ultimately, he feels that what have I done? What is my fault? Why me? So why all these trouble and problems for me? So this is delusion wrong suffered. So for example, uh, a patient taking proper medicine and he feels that his problems are being aggravated. I was supposed to be relieved because of this medicine, but in turn, I am getting worse. So this is wrong suffered. Maybe because of any medicine, homeopathy, allopathy. This is the false perception of the patient. So remorse is a autoimmune rubric. You can always use remorse in any autoimmune pathology or lesser pathology at the autoimmune level. Any pathology which is lesser than autoimmunity. If you see the chart of separation of Honorable Dr. Praful Vijayakar sir, so here any pathology which is at a level which is lower than autoimmune level, so you can treat by those pathologies by entering through this rubric. So it is more of a psychosyphilitic entry point, whereas wrong suffered is mostly sorropsychotic. Why? Because there is no element of syphilis here. It is only the false perception of the patient that he's been suffering for so long. So it is mostly sorropsychotic. So any pathology at the level of psychosis, you can enter the case through this sorrow psychotic delusion. So, as the case which I narrated, hypertension and alopecia areata. So there, that person had a strong feeling that if I could revert the time back, so I could manage the things that time itself, or I would have not left that particular company. So he wants to go back in time and he wants to change things. So this is what is the perception. So this is remorse. So because the pathology was autoimmune, so here remorse was taken. The person was suffering, that is fine, that we can see. But what is deeper in this aspect is the self-blaming that I did a mistake. So that was more syphilitic than uh, wrong suffered. So that is why remorse was taken as an entry rubric. Then second, hyperactivity disorder. Hyperactive children, they come from certain conflict which mother faces during pregnancy. Now what kind of conflict? So hyperactivity means running here and there randomly, chaotically. So mother had felt that I need to run away from certain situation. I do not want to face certain situations, so I want to run away. So that is why the child becomes hyperactive. So she passes a genetic message to the child that, see, I want to run away, so you should be fast enough. You should also have that agility and your speed should be fast so that you can run away from any situation. What kind of situation? There could be many situations. For example, escape from abuse, verbal or physical abuse. So a person wants to run away if he can't face. So there also hyperactivity can develop in the child. Escape from threat, fear, fright, or life threat. So hyperactivity can happen in a child when the mother is having these type of threats. Then escape from domination. So a pregnant mother does not want control of people who are around her, so she wants to run away. Then yes, so all these situations here, what exactly is the feeling of the mother? So the feeling of the mother gives us the particular entry rubric through which we can enter into the case and we can resolve the hyperactivity of the child. Yes, many of the patients, they come with excessive sweating of palm and soles. So most of us, we are puzzled as to what to ask and where to probe. So here, if there is a genetic tendency, then we have to definitely go for mother's pregnancy history. So what type of conflict we need to probe? So if there is a excessive sweating in the palms, so probability of situation could be, see, why would a person sweat excessively? Why the sweat glands are acting hyperly? So why excessive sweat is being produced? So sweat is produced when you exert. So that time you sweat. So when there is exertion, there is sweating. So here the mother's thought process has influenced or has conditioned the sweat gland of the child. That is why there is excessive sweating. So what type of thought process? So mother had a problem with work. So mother was having work issues. What kind of work issues? So either the mother was made to do hard work day and night. So mother felt that I should escape from this situation and my child also will be in the same situation. So he will also be made to do work. So this conflict, it passes on genetically. The message of the thought process of the mother, it passes on to the child. So child sweats excessively. Then either the second situation is the mother feels the need to do hard work because there is a struggle in the life. So mother wants that I should do hard work, I should earn for my family, and she expects the child also that when once you grow up you should work for the family. So this conditioning goes into a child because the child which is there inside the womb, he is very obedient, he is very disciplined, he is very diligent child. So that is why he, in this situation, he takes the thought process of the mother. If the child is obstinate, he may not take the suggestion of the mother in the genes. So this is how we need to understand. And if there is excessive sweating in the feet, then the mother wants to escape, and all the energy is being utilized to escape. So that is why there is excessive sweating in the child, in the soles. What if both the hands are sweating as well as the soles are sweating? What if both? So here in this, the mother was made to do hard work, but the mother's wish was, I do not want to do, I want to escape from all these hard work. So that is why one side work and another side is escape. So here the mother was made to do hard work and she did not want it and she wanted to escape. That is why there was sweating in the palms as well as on the soles. So friends, this is how our thought process should work. And the same conflict applies for a person who develops hyperhidrosis after certain time frame. So the same type of conflict we need to find. So friends, here I hope I have cleared some of the queries, and I hope I have given you some extra thought process. So yes, I am receiving very nice informative comments, and yes, again thank you for all the doctors and practitioners. Once again, I request you to all like, share and subscribe, share to all of your friends, and ask as many doubts as possible so that even I can learn and even I could study again. So yes, thank you. I'll be back.